Greetings, beloved child of God. We thank God for another wonderful evening. And we bring to your homes, to your cars, wherever you find yourself, your health, our concern. And God bless you for tuning with us. And we don't want to do this alone. So I want to invite you to share the link to your family members, to your friends, that tonight there's something beautiful, something impactful coming your way. And you want everybody to be part of this session. This evening we are going to treat breast cancer. Lord, I believe that you heal. Lord, I believe that you heal. Lord, I believe that Jesus you heal. Oh, Lord, I believe that you heal from my weakness. Lord, I believe that you heal. Breast cancer is one of the serious diseases that can happen to you. And so this evening, you want to know what it's all about. And thanks be to God, we have our own Dr.Irene Prah here with us, who will be taking us through breast cancer. Know what it is, the effect that can cause on you. And we believe that our God is our healer. And indeed, when we take care of ourselves and we pray to God, He will heal us.
Hey, now we are the CC Ghana Radio. Hey, now we are the CC Ghana Radio.
Very soon we shall hear from Doc. She's right here in front of me. I wish yes, you can all see her. Very beautiful Doc, by all standard and by all glory. By all glory. Doc, you're looking beautiful this evening.
Thank you very much.
Is there any secret?
It's the glory of God.
The glory of God. We would like to remind you that your health, our concern, is brought to you by Worship Series Publications. Publications have religious and moral education books for JHS people, and they have textbooks and word books and past questions. And so if you want your child to get the best grades of religious and moral education, you can contact Worship Series Publications on 0244 681942 or 0504 681942. If you're using Glow, 0233 681942 or Airtel Tigo on 0275 681942. And also our second sponsor, Mesto Bisab, a suitable drink for all occasions, for your weddings, parties, and funerals, or even for family gatherings. You can have a beautiful drink that also boosts your immune system for good health. You can contact them on 0264 00360 0244 855 558. And Mensdo Bisap is mostly produced in Accra. Yes, Accra. The main production is in Accra. But if you want to get some in Kumasi, you can contact Adunfio or the numbers on your screen, and wherever you are, we can deliver to you. For quick delivery, know that you can contact Fast Pack Delivery Services. So they have the express domestic and corporate pickup delivery wherever you find yourself. For food services or laundry services, you want to post a letter, you want to receive a letter from the VIP station, wherever you find yourself, you can contact Fast Pack Delivery Services on 054 559633. Again, 054 559633. We still want to count on God to heal us. And I want you to join us, sing this song as you share the link to your friends, to your wonderful people that you want them to hear this. God heal us. This beautiful song is coming from our own producer, Mr. Eric Akompong. For those of us who have been watching Other Women's Temples, he's the host of Other Women's Temples. It's his own track. So I pray that you also support him, that this track will be one of the best songs in the country and in the world as well. Heal Me by Mr. Eric Akompong.
Yes, I believe you. Log on to CCL Ghana Radio. Log on to CCL Ghana Radio. Lord, I believe you are a healer. Yes, I believe you can heal. From my weakness, I believe that you heal.
All right, God bless you for staying with us, and I believe God will hear us. But there's something going on, and that we need to really be concerned about. That is COVID-19. A lot of people are saying that COVID-19 is going, but my dear friends, it is not. If I look at the world meter right now, it tells that we are indeed in a difficult moment. My dear friend, just last week as we came, we had over 22 million, but within 7 days we have reached 31,126,569. Please do not lose guard. I don't know who is helping you or telling you to assume that COVID is gone. It is not. My dear friends, if you look at even Ghana's case, as of Sunday morning, we had recorded 20 cases, and it was like a jubilation for us. But now, if you check our case, realize the active cases are going up, and even on Sunday afternoon, we had recorded fresh 127 cases. Doc, is it that we are having, you are close to them, I mean the infectious place, you are there. Are we having empty beds or something? That is why people are assuming that it's over.
Well, we don't have an infectious disease center, so the hospital is always full. But the truth is that I think a lot of people are working on or living on their antibodies now. So it seems as if the cases have gone down. But the antibodies from what we know now last for just about 2 to 3 months.
Oh,
so we are beginning to have cases of people who are getting it again.
is that the case?
Yeah.
So they tested negative,
Yes.
and about 3 months' time, they are beginning to feel the symptoms.
Yeah.
That
People.
was scary.
South Korea has recorded a patient who had it before and now has it again, and we have also seen a case like that. And we are hoping that, of course, the test was safe, but the person got sick again. So now there are cases of reinfection plus new cases. So we shouldn't say that COVID is gone and we can do anything we want, because even in UK now, they are starting lockdown again.
Yeah,
not the whole
second
country.
lockdown.
Yes. It means that the second wave has come. And then, I mean, the second wave is here, and they've started getting new cases. Germany, too, is being a bit more careful. Most countries are trying very hard, but I think people are just not complying.
Doc, this thing, I please help us to understand this. So they probably had the symptoms. They were declared negative 14 days later, and then there was nothing like a new contact that made them infectious, but their antibodies, in a way,
No.
lose guard or something.
Antibodies are soldiers that come when you get an infection.
Yes.
And when you get antibodies, it means that you are either fighting the infection or you have fought it and you are better. Yes. So antibody just means that if you come into contact with, if you have antibodies, you come into contact with that virus, you won't get it again. Like you won't get the infection.
Okay.
But the antibodies for COVID-19, so far it looks like it's just lasts for about 3 months.
3 months.
So after 3 months, it means that you are prone to getting it again.
Okay.
Yes.
So means that they were infected by other contact, not that the virus within them.
No.
Started again.
Well, we don't know, but definitely it will be from. Well, most communicable infections are from contact with other people.
Yes.
So they ask for the reinfection. I can't say it's from within the person.
I'm afraid not, because
I
if
think
it means that the
I think it's from exterior.
Yeah, because if we have to still get the 46,000 people all coming back again, the NNKB. Because Doc, the most interesting thing is that we were talking about United States. United States now they are leading about 6 million, but India, just as even yesterday, Sunday, they've recorded 7,000. Over 300%, and USA were recording 2,500. India recording 7,000 upwards. This is a serious issue.
Yes, one of my cousins is in Belgium. He also sent me a message last week that day they had recorded 1,000 new cases.
1,000 new cases.
So it's going up again.
Please, we need to be very careful. I mean, yesterday I was at Metro Mass. I'm not afraid to say this, and I mean, probably I was the only person wearing the nose mask. Seriously.
I went to the market myself too, and it was the same.
May God help us. May God help us. Not just taking away the virus, but helping us to be disciplined.
Yes.
That is more important as well. May God help us to be disciplined.
So if COVID is not something that kills, then nobody would force anybody to do anything, but it kills, and you can't tell who it will kill. And secondly, people who have gotten it too, some have gotten renal failure, kidney failure, and they've ended up with very bad kidneys and then died. So it's something that we should think about as well. You may survive it, but it may affect your kidneys.
So it's not just about you dying out of COVID. It still have other implications.
Yes, I know somebody who had to go on dialysis after COVID. I know somebody also who got diabetes after COVID and subsequently also died. So,
well, anyway, tonight's session is not about COVID, but the seriousness of the whole thing. Tonight, Doc is going to help us take us through breast cancer. This is not only for women, but of course we have high rate with women, but men as well. So please, if you're a man, do not assume that this was for women, because you also have a part in it. So Doc will take us through breast cancer. That we are well educated about it. If you have any question, do want to send your question to the Facebook platform or the YouTube platform, wherever you find yourself. And then if it's critical, you want to find more, Doc have already mentioned that she will not diagnose online. So please, it's better to meet her at the hospital. Very important. But you can send your question also. Be part. Do not wait for us to finish. You can just let us have interactive. As we go on, your questions will be answered by Doc. So Doc, please take us through.
Okay. So first of all, I'm sure everybody has heard of breast cancer before. Cancer generally is the abnormal growth of any cell. Any body part or any organ is made up of cells. Then the cells come together to form a tissue, then the tissue comes together to form the organ. So the smallest part of any organ is called a cell. But the cells grow in a certain way, and they multiply. Their growth, that's how they grow. They multiply. And then after some time, they die off and new ones are formed.
Okay.
But when it comes to cancer, that same cell is not something from outside. That same cell now multiplies quickly, abnormally, and grows too much, and then causes damage of other tissues surrounding it, and that is called a cancer. So it's not something from somewhere that has become the cancer, but the same cells in your body that is growing abnormally and invading the other tissues around it.
It grows abnormally than
Yes.
is needed, and then the cells now affect it and then becomes.
So let's say maybe if a cell is supposed to produce maybe 4 others a day, maybe this one is producing, let's say, 1,000 a day or something like that.
That's huge. That's serious.
Yeah. So that is what happens in any form of cancer, and then breast cancer as well. And breast cancer can be on any part of the body, any part of the breast.
Okay.
It doesn't have to be maybe just the top part of the breast or the under part. It can be found anywhere on the breast. Yes. We don't really know the cause.
Again.
We don't really know the cause.
I know I'm kind of imagine,
Yes, a lot of the very bad diseases, we don't know their cause, and even when we know them, we don't really.
We don't have enough gadgets to really, pinch through the main cause, or the studies have not gone much to find that.
Oh, I think research hasn't been able to pinpoint the particular thing. If usually when we know the cause, we know that it's this, so we can just take it away.
Okay.
And the person will be fine. Or we have a drug or something that can destroy that particular thing, and then that thing will not happen. But unfortunately, in cancer, we don't really know the cause. We have suspicions.
Okay.
And some of the suspicions are what we call the risk factors.
Yeah.
Risk factors are anything that decreases or increases your risk of getting a particular disease. That is a risk factor. So some of the risk factors are female gender. If you're a woman, definitely you have breasts. So once the breast is there and it's a cancer of the breast, you can have it. It is suspected, however, that it is a change in our DNA. DNA is what is found inside the cell.
Yeah.
So it is your code, sort of. That thing that makes you Francis. That thing that makes me.
Okay.
That is the DNA.
Okay.
And we think there are some genetic changes in the DNA. And these genetic changes, we think that they come about from maybe our lifestyle choices.
Oh, okay.
Could just be age. As you grow older, certain things change, or any other factors, environmental factors. For instance, people suspect that maybe chemicals can cause some forms of cancer and all those things.
Yeah.
So if people are able to pinpoint, particularly, let's say, this chemical is causing this kind of cancer, then it should be taken away from our environment.
Oh, okay.
But the thing is that not everybody who lives in a particular area with a particular chemical may get that form of cancer. So people, you can't really stick your neck out to say this thing is causing.
Okay.
So that is just an example of
of
a risk factor like that. So female gender, being female, and even males also get breast cancer. And then increasing age, as you grow older.
Okay.
Your body doesn't function normally like a young person. So that can also be a risk factor. And then, like I said, the genetic risk factors, there's a particular gene called the BRCA1 or BRCA2 gene.
Okay.
And these ones are inherited. So if, let's say, somebody has it in their family, the mother may pass it on to the daughter and all that.
Really?
Yes.
But they don't have to get to a certain age before they can be diagnosed of it, or just
no,
like...
it's in your gene, it's in your DNA, so it can be picked. I think it can be picked at any time. So I've actually heard of a celebrity, one of these Hollywood people whose mother died of breast CA, and then they found that gene. So at the age of, I think her mom got it, let's say if her mom got it at the age of 30, at the age of 22, she went for her breast to be removed, even though there was no problem. And then they created a new breast for her because she didn't want that situation of even getting it at all.
Yeah.
So some people go to drastic measures to prevent the breast cancer, but she wants to live without her breasts, so that she doesn't get the breast cancer.
Yeah. She saw how the mother suffered, and she's not ready to go to that extent.
And then you can also have, if you've had breast cancer before and you've been cured, the probability is that you can also get it again.
Oh.
Yes. So whatever gene, if it was a gene that gave it to you,
yeah,
that made you get the breast cancer, the gene is still in your DNA.
So if you do the
So you
surgery
could get it.
and take away the breast, it can still affect the other one.
Oh yes, it's you. Whatever predisposed you to that cancer. Once you are still in the same environment, nobody knows what the cause is. Do you get it?
Yeah.
So we can't say that this thing in particular, maybe you are eating something that you shouldn't eat or something like that.
Okay. Okay.
So they are prone to it again because
Okay.
definitely they might not change their lifestyle or the
Yeah.
things that surround them, and they don't know in particular exactly what did that. And then if you have a first degree relative, for instance, if your mom had it, there's a likelihood that you also get it. Yes.
Even if she had it in a increasing age period, like
She gave birth to you.
70.
She shares your genes with you.
But that's scary. So, who someone when you cancer and quadia, she
No,
will
it's
pray
not-
for it or what?
No, it's not 100% risk that you get it.
Okay.
But if she's had it before, then you could have it. If your sister has had it before, you could have it. If your auntie has had it before, you could have it. But it doesn't mean that there are people who have had breast cancer, none of their children have had breast cancer. So that is also one of them. And then any form of radiation to your chest. So chest x-rays that we do in the hospital can predispose you to cancer. So we don't, especially when a woman is pregnant and it's in the first trimester. So pregnancy is 9 months, right? So the first trimester is the first 3 months, second trimester is the second 3 months, then the last 3 months. So usually in the first trimester, that's when the baby is really forming, and the cells are multiplying to form the tissues and the organs. So when you expose the baby or the fetus to radiation, that radiation can interfere with the multiplication of the cells and cause a cancer. So usually when a woman is pregnant, we advise that she does not take x-rays.
Okay.
But if she has to, let's say there's an accident or something and she has a fracture and she needs to,
She has to.
yes, that one, we put a shield, pregnancy shield on it.
Oh, okay.
That is not 100% protective. Yes. And actually any machine emits radiation. One of my engineering friends was telling me that any machine at all emits radiation.
Yes.
So and we surround ourselves with machines at home.
Even our phones.
Yes. So any form of machine at all emits radiation. So there are so many things we are being bombarded with that can cause different forms of cancer. So that is also, so chest x-ray. So we try for children, for instance, because they are growing children, as I said, everything is forming. When they have to take maybe CT scan or in those things, sometimes we say low dose CT scan, or we prefer not to. And even in the hospital, we try not to expose people to too much radiation unless they really need it.
Okay.
So if you really, really need it, that one, you have to go for it.
Go for that, yeah.
But if we don't think it's necessary, we try not to expose you to too much radiation.
Look, has there been any statistics on the number of people who have contracted cancer through the hospital radiation? Do you have that?
Well, I haven't searched for it.
Yeah, but
So-
the hospital, have your attention been drawn to that? A number of cases that has been reported to the hospital, huge number of them are coming from.
Nobody will really know, especially in our part of the world. We don't have that kind of statistics, but
Yeah.
maybe outside somewhere they've done a study, but I haven't looked for any study like that to see. And then increased alcohol intake. So even for the radiation, sorry to take you back.
Yeah.
One of the ways of checking for breast cancer is the mammogram. Mammogram also gives radiation.
Okay. Yeah.
So it means that even though you are using that mammogram to check for the breast cancer, it is also giving you radiation. Yes. So radiation is all
serious.
over. Yeah. So I won't be surprised. That's why some people were saying COVID is from 5G and those things, because it's all radiation.
It's all radiation, yeah.
Yes, but I can't say it is from that.
Look, so who are those? Is it the patient or even the health officer? Who are those people more vulnerable to this radiation, especially radiation? Sorry, at the hospital.
Oh, at the hospital, those who take the X-rays. So we have radiographers who take the X-rays. Yes. So they have a I don't know what to call it, but they have something that checks how much radiation they are being exposed to. But then there's always a window or something like that.
Yeah.
Here that doesn't allow radiation to get to them.
Okay.
So when they put you in the X-ray, they go back, close the door, and all those things to prevent the radiation from coming to them.
Okay.
But they have something that helps them to check that this is the amount of radiation they are being exposed to.
Wow.
And I think they have things that they use to check as well. The physicists and those people who, yeah. So they'll come and check and see if some of the rays are leaving or being emitted from that room. They have to work on it because people walking around that room are not protected.
Yeah.
Yes, so they check all those things. So you can't just get up and go and put an X-ray or a CT scan or any machine like that in any room. It has to be professionally done by people who know how to prevent the radiations from leaving the room.
Okay.
Because if not, people who are walking about will also be exposed to the radiation.
Yeah, Doc, sorry for spending time with the radiation because that is more common and more open to everyone.
Yeah.
Now, you mentioned radiation. Our phones. At what part of our bodies that makes us so vulnerable when we are using the phone and makes us open to radiation? People are saying chest, even our pockets.
Your whole body can get cancer, so it doesn't matter where your phone is. Well, I can't say much about phone. Some people say the phone doesn't cause cancer. Some say it does. I haven't researched on it, so I can't answer that question.
Please, that one, I think the next time, please do next week, because somebody like me, I'm a gadget boy. I mean, I spend so much time on my phone every day, not once a week, every day. So please, yes, that's an assignment for you, Doc. Please continue.
So increase alcohol intake too. Everything that we've talked about, risk factors, alcohol is one of them.
Yeah.
So I think we should just stay away from alcohol or very, very little.
Yes.
Yes. So alcohol is one of them. Smoking is also one of them.
Okay.
Being black African.
Being black.
Of African descent also gives you a high risk. Yes.
Doc, is one racist no? Is it the researchers now?
Well, the radiation, I don't know.
Being black.
Maybe cancer is racist, I don't know. But then also women who are in menopause. When you are in menopause, sometimes they give you what we call the hormone replacement therapy. The hormones, because when you are in menopause, your ovaries start shrinking, so they don't produce the hormones that you need. So you might be put on some hormones to just keep you going as a woman. Okay. And that hormone replacement therapy can also be a risk for cancer. And then contraceptive pills. Contraceptive pills. That also is a risk. So this one, because we know contraceptive pills can cause cancer. When we stop you from taking the contraceptives, it can protect you from getting the cancer.
Wow. Hey, please, those who go for that, are they aware about this, that their contraceptives can even cause breast cancer? Are they aware?
Every drug has the side effects. So you weigh the pros and cons, and then you use what you want to use, and then you pray that it won't happen to you. But every drug has pros and cons. Okay. Please, and then women who also have heavy denser breast tissue. So if the breast is dense, very the tissue in it is very thick, you are likely to. That is a risk. Not that you are likely.
Is it by artificial making it thick, or even a natural thickness or something?
No. The artificial one, you can't make it naturally thick.
Artificial ones.
I mean, the artificial one, you are putting something in it.
Yeah.
No, I'm not talking about that one. I'm talking about the God-given one.
Okay, even the God-given one, Crown, is still vulnerable to that. Hey.
And then when you don't have you have children late in life, so having them late after the age of 30 years, for instance, you are prone to getting breast cancer. And also, if you don't breastfeed your children.
If you don't breastfeed your children?
Yes.
That is you giving birth, but because of work. You are. Is it that those who are pumping or
if you don't
at all?
breastfeed at all, I think. Or maybe I don't know how long you should breastfeed before you are protected, but the only risk factor they said is not breastfeeding.
I think said all the teachings that we have done today looks some way quite scary
Well,
and serious.
what can
Of
you
course,
do?
this is our head. I mean, your head are concerned. We need to let you know the truth and what is going on. Please go for it. But
And then a woman who has had a lot of menstrual cycles. So if you are, let's say, you get your menses very early in life, 8 years thereabouts, it means that you have menses for a long time. So you are very prone to getting breast cancer or late menopause. So maybe let's say menopause starts at 50 thereabouts, and you get yours at, let's say, 55 or after 55 thereabouts. You are likely to you are at risk, not likely. So late menopause, I'm not saying 50 years is menopause, but if you get yours very late, your risk is high. Or if your menses also starts very, very early in life, like say 7 years, 8 years thereabouts.
Hey, wow.
Yeah.
Unfortunate that. Wow.
So, and the more physical activity, if you are also not physically active, you are sedentary, you don't exercise, your risk is also high.
Wow. Wow.
So I want us to also know that of all the cancers in Ghana, breast cancer is a quarter of all the cancers in Ghana.
Okay.
Forms 25% of all the cancers
Wow.
that we see in Ghana.
Wow.
So when you see 100 people with cancer, it means that you are likely 25 of them are likely to have breast cancer.
Breast cancer. Wow.
And then the rest will be other cancers. And 10% of that 25 people are men.
Huh? Doc, repeat. repeat.
So if you take 100 people who have cancer, if you go to, let's say, a cancer hospital, and you take 100 people who have cancer, it's likely that 25% of them will have breast cancer. So that 25 people, if you check, 10% may be men.
Wow.
Yes.
Wow. We used to think that this is breast cancer.
So if you have
100
people, 100 people who have breast cancer,
25.
10 of them will be men.
10 of them will be men.
Yeah.
Hey, it's not even a small number.
No.
Hey. Please continue.
Yeah. So basically, those are the risk factors. So you just have to stay away from. If you want to prevent breast cancer, first of all, learn to exercise.
Exercise.
Yes. Make sure you are eating healthy and you have a healthy weight. Avoid sedentary lifestyle. So move. Just stop eating all the processed foods and those things. Like I said, we don't know the cause.
Yeah.
But a lot of processed foods have been linked to cancer, especially colon cancer and all that. So since we don't know the cause of any particular cancer, and processed foods have been linked to some cancers, then try and stay away from processed foods and eat more healthy food. So basically, most of the diseases, like I said, is exercise and healthy diet.
Yeah.
So try and stay away from that. Take less alcohol or no alcohol. Breastfeed your children if you have the opportunity and you have children and the breast milk is coming. Don't prevent the children from getting the breast milk. Breastfeed them. Don't only pump it and give it to them, but breastfead them because it's protective.
Yeah. Okay.
Yeah. And then you can also hormone replacement therapy. I don't think it is how do you call it? It's compulsory. So you can stay away from it. There are people who don't have money who don't go for it, but they are living their lives normally. So you can stay away from the hormone replacement therapy. Chemotherapy itself, that is used to treat cancer, can also cause cancer. So that's as well. And you can have the preventive.
What is used to treat cancer?
It's radiation.
Cancer.
It's radiation. We have radiotherapy, which I mean, cancer is funny. Yes. So there are some that you can't do anything about, like age. If you are growing older, you can't do anything about it. It's not your fault.
Yes.
If you are not married after 30 years, you are not married. and you don't want to have children outside pregnancy, outside marriage, it's not your fault.
Yeah.
If you are married and the pregnancy is not coming, it's not your fault. So there are some that, and if you are a woman, it's not your fault you are a woman. If your breast is very heavy, it's not your fault that it's heavy. God is the one who decided to give it that. So there are some that you can't do anything about, but the ones that you can do something about, you do something about them.
Yeah.
So exercise, eating healthy, and all that. So processed foods are nice, but once in a while.
Once in a while.
Try
It's very true.
yes.
Yeah. Very true. Once in a while.
Yeah. Fancy girl like me, I can't stay away from pizza. So I cut down on it. So yeah.
Look, I don't know if this question will help the symptoms. I don't know. Can we? Or you have something?
Okay, so the symptoms. I have some few pictures that the producer can show us.
Okay, producer, please. Doc wanted to show the first picture. Is it the producer? Okay, Doc. Yeah, he says he's there.
Okay, so there can be some rash or crusting or itching around the nipple. So if you look at the picture that is being shown, the first picture, there's some crusting around the nipple.
Okay.
It's as if breast milk has, how do you call it, seeped out and it has dried on the nipple.
Okay.
So there's some crusting around the breast, and then it can itch. Then you might see some rash as well. Yeah. And the second picture, if producer can move on to the second picture.
Yeah, he said it's ready. Yeah.
The second picture too shows some discharge from the nipple. Okay. So normally, if you are not breastfeeding, nothing should come out of your breast. So if something is coming out of your breast when you are not breastfeeding, then you should go for it to be checked.
Okay.
So
as somebody in Anna say, even while you are going for checkup, you are still open to it. But please, yes. Sorry, let me ask this. Now, there's this small symptom that you might have it. Will the radiation from the machine not make it so open for you to get it, or it's not automatic? So
well, we use machines to diagnose, so you can't really stay away from.
And it will not increase the risk factor of getting it.
Well,
that's what I was asking about the report of people, because I hope that our listeners, please, we are saying that the machine can, but that does not give you the liberty not to go for a checkup, because that could be even the worst case. So it's look, I think you have to advise people on that. Yeah.
Oh, that's one. That one there. I mean, like I said, you must go for the checkup.
Yeah.
Yes, you must go for the checkup. So you can't say because of the radiation you want to also go for checkup. Yeah. I
mean, the phone is a risk factor, but we are still using every day. And so please continue. I think.
Yeah. So you see nipple discharge. There can also be some color changes on the breast. So you will see for a dark person, I would say maybe some darkening around the breast. Maybe for a white person, it might be reddening or something like that. So once something is coming out of your breast and you are not a mother, you are not giving any child breast milk, please, it is not normal. Some people think it's normal. It is not normal. So please, that one you have to go for. Check.
Yeah.
And then the third slide,
producer,
you see that there might be some change in the nipple itself. So the nipple will normally, nipples are supposed to stick out. Yeah. Or even if it's not sticking out normally, when the weather is cold or you are doing some activity or something like that, it should come out. But in this particular person, you see that the nipple is inverted. So it has gone in. It's not flush with the skin, but it has really entered the breast. It might not be the same on the other side. It is rare to get breast cancer happening at the same time in both breasts. Okay. So you might see that the other breast is normal. Okay. But this one has you started seeing some funny changes. And then the skin too might change. So you see that this particular picture shows the holes around the breast being bigger, like the skin of orange, the orange that we eat. You see there's some holes around in the orange. So they use the French word for skin of orange to describe the skin change, which is called the peau d'orange. So it's just skin of an orange. Orange fruit. So you see that breast starts changing and looking like the skin of an orange.
Okay.
So let's go to the fourth
Log on
slide.
to CCL Ghana Radio. Log on to CCL Ghana Radio.
Let's go to the fourth slide. Like I said, skin changes coloration. There's some reddening of the breast, and then when it gets terrible, the mass or the lump will now. I said cancer is growth of the cells invading the tissue around it.
Yeah.
So it will invade the skin around the breast,
Okay.
and then come out, and in English you call it fungating.
Okay.
So it's like fungus, like mushroom. The way mushroom is,
Yeah.
you know, mushroom has all these.
Yes.
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 So fungating, and ulcer, ayokro.
Yeah.
And you just see say ayokro, and it's very offensive. It smells. Yes, it's very
If
offensive.
you look at that small, is it a discharge or just?
Once the ikrono comes out,
Wow.
it smells very bad.
So uncomfortable.
Yeah, any cancer that becomes ikro, an ulcer, forms an ulcer, smells very bad.
Wow.
So that is it. So you shouldn't let it get to that stage.
Yeah.
Yes, you shouldn't let it get to that stage. And then the next slide, like I said, the nipple changes. You see the nipple going inside. And the other slide also shows two breasts that are in different sizes.
Oh, okay.
Every woman has one breast bigger than the other. And then some people grow up with a very big one and then a very small one. But if that is not how yours is, and you are growing, it has always been, you know, the size and the shape. Then one day suddenly one is being lifted up, or you feel something in it making it lift up, or the shape is changing.
Yeah.
Then you have to check and see,
Yeah.
because normally when you are growing older, gravity will pull it down.
Okay.
There's nowhere in the world where the woman is growing older and the breast is rather coming up. Yes. So if you see any such changes that is really going up and the shape is changing, the size is becoming bigger and all those things, you have to go for it to be checked.
Okay.
So that is important. So any change at all in the breast, you have to be concerned enough to go for it to be checked. Sometimes you obviously see a lump sticking out. That is when it has become too big, actually.
Oh, okay.
So,
Okay.
and then sometimes you see puckering of the breast. So, so let's say if something is pulling the skin, skin no akotutum.
Yeah.
So
yeah,
you might see
yeah,
that is what
yeah,
we call puckering. You see
yeah.
puckering of the breast
Yeah.
like that. So those are all changes.
Yeah, but I don't know if majority of the symptoms that you mentioned are for the women. I don't know you have for the men or but.
There are similar changes.
There are similar changes.
Yeah, it's breast,
Okay.
so it's the same
Okay.
actually.
Okay.
I don't think the men is
Okay.
that different. Yeah.
Okay.
But we get men who also go for chemotherapy for breast cancer. So
Yeah. Yeah.
it's normal.
This lamp thing, when it starts, I don't know, maybe. Probably I'll wait for this question when it gets the diagnosis or something. I don't know.
Okay.
Yeah.
So one of the ways of also preventing is doing breast self-examination. You have to be examining your breast yourself. So as for that one, I can't show it here. So the viewers can Google how to do breast examination,
enough, yeah.
self-examination. But it has to be done at a particular time of the month.
Okay.
And after your menses.
Okay.
Because before your menses, your breast changes happen. Some people's breasts become more bulky and all those things. If you go and touch it at that time, you think something is growing in it.
Oh,
So
okay.
wait when the menses is gone and then you have your normal breast. So let's say if you have regular menses, for instance, and let's say you always get it, let's say on the 30th or something like that, you can always do it on the 26th. You can decide that I'll do mine always on the 26th when my menses are over. Then you check, because that is the normal for that particular time of the month. So that if there's any change at all, you can say that, oh, this one there, I know it's a change.
Yeah.
Because my breast has always felt a particular way.
Okay.
Yes, so that as well. And I think that sometimes some women also get lucky and their husbands are the ones who actually pick the masses, because we women, even though we don't really touch ourselves like that, but so if you are married and the man might be the one who might pick it.
Okay.
Yes, but it's something that we should all learn to do, especially when we are growing old. Let's say when you hit 30, you have to start making it a point to at least examine your breasts as often as possible.
Yeah. To know that if there's something wrong with it.
Yeah.
But the earlier is better for you to know that something has changed in me.
Yeah.
And I need attention to that.
Yeah.
Very important. Good. Doc, so now we've learned about today. There was so many things. If we don't end, we will have to continue later. But we've known the symptoms and then the risk factor.
Yeah.
Even though you mentioned to us that we have some machines to diagnose, but then I earlier wanted to mention this, the lump. When you identify that all these things are coming, can you quickly attend to it, remove it, and do something about it and stay free? Or
so once you see the lump, that you have to visit the hospital for them to check for you.
Yeah.
You usually have a lump. There are some lumps that are not cancerous.
Oh, okay.
Yes.
Okay.
That doesn't mean that anytime you see a lump, it is cancerous.
Okay.
But that is why it has to be checked. Yes. So you have to go. Confirmatory, you have a breast clinic, a clinic just for breast. So any breast issue, when you go to a breast clinic, they will see it for you. The people there are surgeons, so if there's any problem, they will tell you, they will continue the management for you. They are the ones who see breast cancer anyway, so there's a breast clinic that you can go to. So if there's a lump that they see, usually if you are below the age of 40, they will do ultrasound of the breast. Ultrasound does not emit radiation, so that one is safe.
Okay.
Yes.
Okay.
For people under the age of 40.
Under the age of 40.
But when you grow older, when you are above 40, your breast becomes a bit denser. So you need a mammogram to diagnose. So the ultrasound may not really pick out anything. Ultrasound is also for a particular spot.
Okay. Yeah.
So because if you've done ultrasound before, you know it's a probe that you wrap over the area.
Yeah.
So it doesn't look at the whole thing in totality, but it focuses. I mean, they will do everything. They will go around and make sure they don't see anything. But if there's a particular lump you've picked up, to be able to look at it, it will give them some idea. And then we have something they call the fine needle aspiration. They use a needle to go into the lump and withdraw some stuff to also test, take it to the lab and do histology on it. Then they will tell you whether this is benign or it is malignant. So benign means it's normal. It's just a lump, but it's not cancerous.
Right.
And then malignant means it's cancerous.
Okay.
So they will tell you whether it's cancerous or not.
Okay. Doc, sorry, I don't know whether it's my spirit or something, but I sense somebody wants to know what is lump. How do you know that this is lump, or how does it feel? I don't know. Even this, if you can say it in tree, something.
Lump.
Yeah, lump. What
lump
is it?
Here, in fancy, I'll say nkutwa. I don't know whether in tree. In tree, I don't know what's nkutwa. I don't know.
How does it look like, so that people will know? I mean, at least when you use your hands to, your own personal diagnosis. How do you feel? What does it look like?
Oh, the women will understand. Bibi have a share or what to say ball.
Okay, so something like we can say a poby have a show.
Bibi have a share.
When I then like it looks harder.
It might be something that moves or it does not move.
It moves. Oh.
But not that it moves. Say it will move around the breast.
Okay.
But you can move it a little. So a po. I mean, I think that's the.
Yeah. Okay.
That's the
I
word.
think you are clear. Yeah. So it's not supposed to be there, because especially previously you did not have that.
Yes.
And then later realize that there's something like
or abba.
a baby show
Or something like that. But every woman has abba already in the breast.
Okay.
Which is round and is in the middle. Every woman has abba in the breast. But this one, you see that this one is not there. It wasn't there before.
Okay.
Yeah.
Okay.
So.
No, the diagnosis.
So sorry, I was saying that women under 40, you do the ultrasound. Then women under above 40, you do the mammogram. So mammogram is like a plate. Okay. It's like an X-ray. You stand there, then you put your breast on it, then it's like a plate. It comes to lie on it, and I think it takes the picture.
Okay.
So the radiologist will read it for you and tell you whether there's something there or not. And it's something that you have to do yearly.
Yearly, okay.
Yeah.
Okay.
And then I think above the age of 49, you have to do it twice a year or something like that.
So when you're above 40, you don't wait to get that lamp or discharge, but if possible, yearly.
No, I mean, so you have to do regular checkups so that if it is, they can pick it early, then they will be able to just remove the lamp and not have to remove the whole breast, or they might pick it before it becomes cancerous or something like that. So if they do the fine needle aspiration and it's benign, they might just tell you that it's benign, so you can walk about with your lamp. Or if you really want it out, then they will advise you appropriately.
Okay. You know, almost all the the past weeks, the diseases and this, they looks like incurable. What about breast cancer?
The cure rate of cancer is low.
Low.
Yeah, but if it is seen very early, it will it can be cured.
Okay. Yeah.
It is seen very early. It can be
when
cured.
you take away the lamp.
Yeah,
Okay.
but cancer is not 100% that if we find it, we'll cure it. Most cancers, you have to catch it very early for it to be curable. And even those ones, sometimes it comes back. Like I said, if you've had a breast cancer before, you could have another one.
Wow. So I don't know. It appears that it's something that is so much in the system. You know, when we were down, I was just going through all this, and I saw that about 2 billion people are living with cancer. This is serious. Is it that it's human communicable, or is it just because of the genetics or something? Why does it make it so? Or is it just because the cells are always producing? But I don't get it. Why?
That's what I'm
is it
saying.
so
We
much?
don't know the cause. So if there are radiations around us, chemicals, we are eating things that we don't know, they are too processed foods that have chemicals poured on them. We don't know the cause of cancer. That's why the cancers have multiplied, because if we could say this thing in particular is causing cancer, then we'll work on it. But
Wow.
we don't know. So there's something in the environment, maybe something we are eating, maybe some lifestyle, alcohol, smoking, and all those things that can cause cancer.
Look, this is serious. just we will come back, my dear friends. We are listening to breast cancer, and personally, what I've learned today, it looks scary, but I believe God is on our side, and when we take very good care of ourselves, we will be free. But just a minute. Let's take this short break, and we shall come back.
This is CCR Ghana Radio. Support us to sustain our programs. Send your contribution to our MTN Momo 0555554230 0555554230. Make inquiries and send prayer requests to the same number. God bless you.
Welcome back, Doc. Please, what again do you have for us? Because our time is fast spent, but I realize that we still need to know some of the things.
Also, it's just the treatment. The treatment, as I said, if you go to a breast clinic, they will look at the kind of lamp you have, and then they will advise you whether they should just remove the lamp, or they have to remove the whole breast, or they have to just remove the breast plus the lymph nodes in your armpits. So depending on the stage of your cancer, that will determine the kind of treatment. But most of the time, after that, you may have to do chemotherapy as well.
Okay.
Which is the cancer treatment. People lose their hair and they lose a lot of weight and all that. It's very... I mean, the chemo itself, it's so terrible that it can kill you. So, and then some people, if you are lucky and you have some money in a part of the world, you must have the money for it. They can reconstruct a new breast for you. But of course, it won't be a breast with feelings like God has created. So they just put something in it and create a breast. If they've taken your nipple, which definitely they will take away, then some people just tattoo a nipple on it. Sometimes it's just a mound so that when you dress up, it won't look okay. But if you don't want the breast reconstructed, then they'll just give you the bra, you put the things in it, and then. But the other thing too is that cancer, when you get a cancer, it doesn't only stay in the breast, but it can spread to the lymph nodes in the armpit.
Oh.
Yes, it can block. I don't know how to describe, but there's something called lymph. It can block it and make the arm very swollen. It can spread to your liver. It can spread to your lungs.
Oh.
It can spread to even your brain for you to.
Wow.
So,
Wow.
breast cancer, if you allow it to progress, it doesn't just stay in the breast, but it spreads everywhere. So cancer is like that. It just likes to make friends. So it will make friends with your whole body, and then eventually it will kill you.
Becoming comfortable in the system.
Yeah, so it eventually kills. So basically that is breast cancer.
Wow. Is it expensive to treat? Maybe that's why. Let me find out. I mean,
in our part of the world, definitely.
It's expensive.
You definitely have to buy some of the drugs. So once you are...
This one, health insurance does not cover everything.
I don't think so.
Oh.
But I don't know. So I would rather not talk about money.
No, the reason why is that, you see, it's good that when we started this program, we had to go through the system and how the hospital works, because people have some mentality that prevents them to go to the hospital and then fall on herbs. So that's what I was asking, so that we don't go for some herbal treatment, but at the end of the day, it's not really helping.
So because I don't do everything, as I'm treating the topic, but I don't really treat breast cancer.
Okay.
I only treat the complications that they come with as an emergency.
Oh, okay.
So I don't know the details of the treatment. But as I said, this is Ghana. Most of the drugs are being bought. Even the drip that we put on patients now, it is cash and carry.
Wow.
So I don't see how breast cancer treatment will be fully 100% free.
Yeah.
That I can say. I don't think it's 100% free.
Of course, yeah.
Maybe the government subsidizes. I don't know. But there's nothing really free in Ghana now when it comes to health.
Yeah.
So,
but then whether there's money or not, still you need to go to the hospital.
oh, definitely, please. You have to go to the hospital.
I think we need to do this. It's very important. I mean, don't just say Minisika and let it go to the West and kill you.
Yeah, so if you don't want to also spend too much money, do your breast exam so that you pick it early.
Yeah.
So that's what I can say.
Please continue. Please continue.
Yeah, so there's no age limit to breast cancer.
Okay.
Any age at all can get breast cancer. Like I said, we don't know the cause. It's all over.
Look, I said I won't ask a question again, but this way permit me. Are you saying that even minors can be diagnosed?
Breast cancer, I had a senior in medical school who, I don't think she was even 25. She got breast cancer and died. So.
And died?
Yeah, she died.
Please continue.
Yeah, so basically that is breast cancer. That's about
because I'm just perplexed. So, anyway. My dear friends, may God have mercy. May God have mercy. And I believe that you've taken notice of all these things, especially we do not have a cause. But yes, we know that we can be prone to certain things. But we need to take very good care of ourselves. Very much important. Take very good care of yourself. And you know, almost all the days that Dot have come here, she just hit on one particular thing. Eat well and have regular exercise. It is the best treatment and the least cost of all the treatment you can have. Doc, I don't know. Yeah, our time is fast spent, and then looking at it, it will be very difficult to answer the questions now. But I believe that maybe next week we can pick the questions and answer them. Maybe your last words on this breast cancer issue.
So I think I'll just advise everybody, males and females, to try and do self-breast exam as often as possible. And then if you are above the age of 40, for instance, try and get a mammogram done almost every year. So basically.
Okay, thank you so much, Doc, for your time.
I am the God.
This is your health our concern.
I am the Lord.
So many things are happening in this world, and that's why we bring you this book every Monday, 6 p.m. to 7 o'clock p.m.
Healed your disease. I am the Lord, your healer.
To sponsor this program, we have our numbers written down below the screen. Just send us Momo to keep us be able to run this program always. We need to sustain the studio. We need to sustain everything that we have here. So we need your support. Keep on supporting us.
And I sent my word, and I healed your disease.
Our appreciation goes to Dr. Irene Prah, making time with us, and also you, our listeners. With you, we are encouraging. With you, we feel that yes, this program is so much important to the world, and that is why you have to be with us. God bless you so much.
That healeth thee.
And so, here is where we bring the curtains of this program to an end. We shall see you same time next week, Monday, 6 o'clock p.m. My name is Francis Osai. I've been your host this evening. God bless you. Stay safe. Don't forget, COVID-19 is still around. Wherever you go, please, your nose mask. Do not let it down. Next week, I will let Doctor just give us a brief picture on how we wear our nose mask and the importance of wearing the nose mask before we continue with our topic. But for now, may God keep you safe. May God protect you. Lord, I pray for all those who are having these symptoms of breast cancer. Lord, may you touch them. May you heal them. Decrease the mortality rate of breast cancer and protect us. Even if we are having this through genetics, Lord, keep us safe. We ask all this through Christ our Lord. Amen.
You are the Lord.